Hi, my name is Jack Finkelstein. I'm a paramedic. I've been in EMS for over 40 years. I'm an instructor at two different colleges. I teach emergency management courses, paramedic courses. I teach for FEMA, OSHA, State Department of Health, and a number of different other organizations. I'm doing this video for the students at my Kingsborough Community College, but anybody could use this information. I am going to be talking about the PPEs, the various types of PPEs, the different examples that I'm going to show you at the levels A through D. I'm going to talk to you about some nomenclature. You hear a lot of words being thrown out and used interchangeably, and I'm going to explain what it should be. I'm going to talk about bacteria and viruses, about the formula for infection. Also going to talk about the COVID-19 and about statistics. Okay, so I'm going to cover a lot of materials here. So we're going to start with some of the nomenclature. You hear on the TV and the radio, they use it interchangeably, the words quarantine and isolation. There is a difference. When someone has the signs and symptoms of a disease, particularly ILIs, influenza-like illnesses, that means like sniffling, cough, fever, that sort of thing. And so if they have the signs and symptoms of a disease, they are isolated. They're separated from others so as to not to infect other people. If someone may have been exposed to someone that is contagious, but they don't have the signs and symptoms, then they are quarantined because we need to see over a period of time if they manifest, if they develop the signs and symptoms of that disease. Okay, so for the COVID-19, we're talking about 2 days to 14 days for the quarantine. All right. Also, the terms donning and doffing. Donning is when you put on a PPE, personal protective equipment. Doffing is when you remove the PPE. There's a difference between incubation period and window phase. Incubation period is a time from when you're exposed to a disease to when you develop the signs and symptoms of that disease. That's the incubation period. The window phase is a time period from when you're exposed to the disease until it shows up positive on a test. This is why under the OSHA rule, if you have occupational exposure, you should have your blood tested in less than 72 hours. The reason is because for almost all of these diseases, it takes at least about 72 hours before it can show up positive on a test. Like this, if it shows up positive within the 72 hours, then it wasn't from that exposure. You already had it. It protects the employer. If it shows up negative, okay, then they'll test you 1 month, 6 months, and a year later. If you become positive during any time during that year, then they can attribute it to that exposure, and you cover under workers' compensation. If you don't seroconvert within the year, then you have a 99.997% chance of being in the clear. Okay, these OSHA rules I'm quoting are under the CFR, which stands for Code of Federal Registry. The 29 CFR 1910-134 is the Respiratory Protection Program, and the 29 CFR 1910-1030, which is the bloodborne pathogen. Okay, so you can make reference to those. When we're talking about the PPEs, there's two different aspects, two different variables, and that's the skin protection and the respiratory protection. So there's level A, B, C, and D. Level A offers the highest level of protection for both the skin and respiratory. So level A, like with this picture here, okay, well, level A, you have a suit, you're inside a suit that protects you against everything from the outside environment. Nothing can get in, no fumes, dust, mist, nothing can get in. And so that offers the highest protection for skin. And then for the respiratory, you're wearing what's called an SCBA, like this here. That's a self-contained breathing apparatus. It's an air tank with a tubing that goes into a full face mask. So you're breathing the air from that air tank. So you're not exposed to any of the outside air, any of the ambient air. And that's inside the suit. So you have the highest protection for both skin and respiratory. That's a level A. This is a level B, sort of like what the firemen have, where it offers the highest protection for respiratory because, again, you're still using the SCBA, but the skin protection is not as high. That's because you still have some areas exposed, and the tank may be on the outside. It could be on the inside, but you don't have the full protection for the skin as you did with level A. Okay. So when we're talking about SCBAs, the self-contained breathing apparatus, if you've heard of scuba gear, that stands for self-contained underwater breathing apparatus, because you have an air tank to the tubing, to the mask, and you're breathing the air from that tank. Okay, that's what scuba stands for. So that's level A and level B. When we talk about level C, okay, when you talk about level C, we're talking about either an APR or a PAPR. So this is an APR, an APR, air purified respirator. And what it is that it's a mask, and it has cartridges that you can put either on the front or the side, depending on the type of mask. So an APR is air purified respirator, and what it is that you're using your lungs to breathe in, okay, to suck in the air through these cartridges, okay, and the cartridges is the important part of this. The cartridges could be chemical specific. For example, if you work in an environment that deals with ammonia, you may have ammonia cartridges. Otherwise, like what we have in the hospitals, we have the NBCR cartridges, which is nuclear, biological, chemical, and radiological. So it offers protection for all of these types of elements, because you never know what you're going to come across. And those cartridges are a lot more expensive. They're heavier, they're larger, okay, compared to, say, a HEPA cartridge that's just for filtering the air for biological elements. Okay, so that's an APR. A PAPR, like this, a PAPR is a powered air purified respirator. So that's an APR, and this is a PAPR. So powered air purified respirator has a battery into a device that has a fan. You put in your 3 cartridges, okay, for this type. This is a 3M model that most hospitals have. And so what it does is that with the battery, it runs the fan, it sucks in the ambient air through these cartridges into the tubing and creates a positive pressure inside the hood. So if you have a beard, glasses, whatever, you can just slide that hood over you, and because of the positive pressure, okay, it doesn't allow ambient air to get in. Okay, so now PAPRs and APRs, you can't use in a fire scenario with the smoke, because it doesn't create oxygen. Okay, it's only filtering the ambient air. Whereas with the level A and B that you're using an air tank, you can go into an environment that has little to no oxygen, because you're breathing the air from the tank. So that's the big difference between the two. The hospitals are required to have a level C protection, PPE, because it's used mostly for, say, for decontaminating patients. Sometimes on the scene, the normal operations are that if there is a scenario with a hazmat of any type, the fire department responds and they decontaminate the patients there first before going to the hospital. That's the normal operations. What tends to happen is that you have some people that will go to the hospital on their own. They will on the outer lining areas. They're not totally affected, and so they may have some chemicals or biological agents on them, and so they need to be decontaminated. So in the hospitals, by using these PAPRs, okay, they could put on the PPE, don the PPE, and then decontaminate the patients. Dawn soap, D-A-W-N, Dawn soap is one of the best surfactants that's out there, and just about all the courses I've taken, they mention Dawn soap by name. That's what they use. You hear when you have those oil spills and they want to clean the animals, you know, the birds and so forth, they use Dawn soap. It's not that expensive, but it's good to have by the gallon, you know, for these type of purposes. Okay, so that's level C. Level D stands for dummy. Level D is really just your clothes. It could be a gown, isolation gown, surgical gown, or again, just your clothes. And if you were to remove your clothes, that's called dry decon. Most people wear clothes and you only have your arms and face exposed. So if you're exposed to anything, by removing your clothes, you've decontaminated yourself about 70, 75, 80%, depending on how much is still exposed and if it was something liquid that soaked through. And so that's called dry decon. So for skin, it doesn't offer offers kind of little protection, some, but a little protection. And for respiratory, you can have a simple face mask, a respirator mask, a cloth over. So respiratory also doesn't offer as much protection. And so these are the four different levels. I have some examples here to show you. So when we talk about protection against what you breathe in, we have surgical masks, respirators, we have valve respirators, and we have respirator surgical masks. Okay, so now you've heard of N95. That's the big name you hear now, N95s. But there's N99s, there's P100s, there's all different types. A lot of people think that's just N95. I'm going to explain to you what these means. The letter could be N, R, or P. The N means that it only filters against biological agents. Okay, it doesn't protect against any kind of chemicals. The P means that it protects against certain chemicals for a period of time. So the package insert, okay, you have to look at it and it'll tell you, for example, the Ilcor P100 PAPR filters about 30-35 minutes for certain nerve agents, just as an example. The number, what it tells you is, the number reflects at what percent does it filter at 0.3 microns. So an N95 protects you against a biological agents, 95% at 0.3 microns. How does that help you? Well, most of these bugs are anywhere between 1 to 5 microns in size. So if it protects you 95% at a third of a micron, that's pretty darn good. Now the OSHA rule, the 29 CFR 1910-134 Respiratory Protection Program from 1992, when it first came out, said that you had to wear HEPA masks. HEPA masks will filter 99.997% at 0.3 microns. That's great, so why don't we wear these? Well, what happened was when they first came out with the rule, and people had to get fit tested for it. Fit testing is, anytime you wear a respirator, and I'll cover that in a second, the respirator, you have to be fit tested. It means you put on this hood and you do the whole thing with the spray, and that's to ensure that you have a good seal. In other words, you can't have any facial hair that passes the crease of the smile or the cleft of the chin, because facial hair would create a gap and ambient air can get in. So you have to have a complete seal because it's a respirator. And a respirator, for the most part, filters what you breathe in. Okay, so they do have cautions on these. Okay, they have precautions on these because it can affect your respiratory system. So because these were so difficult to breathe through, it's like trying to breathe through a roll of Bounty towels. Healthcare providers weren't really compliant with these. So because of that, they came out with the N95s. So the N95s work well for the healthcare setting, and with that, it's easier to don and to doff. They're less expensive. They're about $1.25 each, depending on the type that you get. And so people are more compliant with those, and that's when the rule changed a few years after. I think it was in 1995, actually. So we'll start out with surgical masks. So surgical masks or face masks, you have two different types: face masks and surgical masks. So they're kind of similar in that, for the most part, they filter what you exhale. So with a surgical mask, a surgeon wants to keep the area sterile, okay, a sterile field, because you're opening up the body. So for the most part, it's filtering what you exhale, right? That's why in a hospital setting, if somebody comes in and they have the ILIs, the hacking, coughing, spitting, they put on a surgical mask to protect everybody else from what that person might expel into the air. It could be droplet precaution or airborne precaution. Droplet precaution means that if somebody spits, coughs, or sneezes at you, okay, these droplets will fly out, and they say about 6 feet. It could go over 20 feet. And so those droplets, if you inhale that, can then infect you. Airborne precaution means that, okay, these bugs, bacteria, or viruses will remain in the air, okay, for an extensive period of time. So you have to have a protection against breathing the ambient air compared to just the droplets. So for droplet precautions, you use the surgical masks, okay, and these are simple masks. They have a little metal piece on here so that you can mold it around your nose, and then the ear loops or a tie so that you put on, but it doesn't have a full seal, okay, because for the most part it wants to prevent what that person's coughing or sneezing or even when they speak, okay, from anything being expelled from that person that can affect others. That's a surgical mask. Now some surgical mask comes with a face shield, again, to protect the eyes. The eyes are a mucosa, okay, so if there's anything in the air, okay, the person could become infected from anything that enters the mucosa. The mucosa is your eyes, your nose, your mouth, right? So you have these face shields, or you could wear a surgical mask and a face shield like this, okay? And then this will also help protect against anything that's coming towards you, right? Or away from you. That's face shields. Respirators. We have all types of respirators. So these are respirators, okay? This is a respirator. And this type is what's called a surgical respirator. Now you can't really tell the difference, and it doesn't even say it on here, all right? But I'll mention what they are. And you have these types of respirators as well too. So I'll start out with the Technols. These come from Kimberly-Clark, okay? They're pretty good. A lot of hospitals have these. The only problem that I see with these is that the elastic band, okay, they tend to stick together or they tend to break easily, all right, depending on how they're stored, right? They do have the little metal piece. So now a respirator, again, filters what you are exhaling, right? So you have to get fit tested for this. You can't have the facial hair, right? So this goes on, and you mold it against your nose. And once you don any respirator, you always have to do what's called the negative pressure check. That means you inhale deeply, and you should feel like the mask is trying to collapse on you. And you should hold it like this with the elastic between your fingers, okay? Place it under the chin. See what I mean? Cheap. So what we did here was that we sewed on these nice elastic bands to it because they tend to break. That's why I don't like these. Okay. So what we do is place it under the chin. And by the way, one extra step that I recommend is closing your eyes when you do this. I'll tell you why in a second. Oh, this one's too tight, too small for me. Anyway, one band goes above the ears, one band goes below the ears. Okay. So with these respirators, again, you want to see that it says NIOSH on there. If you look closely, it'll say N95. You see that right? Yeah, N95 and NIOSH. Okay. NIOSH is the National Institute of Occupational Safety and Health. They are a part of the CDCP, the Centers for Disease Control and Prevention. And so they do the testing for the particulates that it filters, and they certify that this will do what it says that it does. Okay, again, one band goes above the ears and the other band below the ears. You do the negative pressure check. Okay. You have this type as well, and these, like the 3M, and this is 3M and this is also 3M, but they're different types. These have a valve. Valves are great, and I'll tell you why. Because when you breathe in and out of these, you are exhaling carbonic acid. That's carbon dioxide and water. And so it gets kind of moist and kind of funky in there, and moisture harbors bacteria. If you're doing extended use for a respirator, you could wear it for up to 8 hours. Or if you are using it for small periods of time, you could reuse them up to 5 times, donning and doffing 5 times. That is the CDC recommendation for if you have a shortage of PPEs, like we do now with the COVID. All right, so with the valve, what it does is that it stays cooler, all right, because when you exhale, the valve opens up and what you're exhaling comes out through the valve. This is why this is not that great for surgeons, because again, the surgeon wants to maintain a sterile field or a clean field, and here what they're exhaling will go onto the body. So but if you're using it for an extended period of time, like during 9/11, these are the type that I wore for 16 hours back to back, and respirators, usually after 20 minutes you start feeling a little bit of difficulty in breathing. So these you can wear for a long period of time and still feel better about. The surgical respirator, what it does is that, well, by the way, all these respirators, they have a certain coating. The coating will help also to kill off certain bacteria and viruses as well too. But surgical mask will filter what you exhale and will also filter what you inhale. Okay, so this is great for, say, if you're a healthcare worker and maybe you have some ILIs, you want to protect someone, someone else, but also you want to protect what you're breathing in as well too. So this is what a surgical respirator is for. As far as eye protection, again, you can have the face shields. You can have goggles, okay, like these glasses rather, or these nice thick goggles. Okay. Oh, and by the way, there's some of these knockoffs on respirators. I almost forgot to tell you. These knockoffs on respirators. You have the KN95. That stands for Korea. They come from Korea. Okay, and this one says respirator. All right, it says it says respirator. This says N95, but they're not NIOSH or FDA or any kind of approval. So, how good are they? Are they actually tested? During the shortage, fine, wear them. But under normal circumstances, I wouldn't really trust these. Okay, and as far as for the hand for protection. Years ago, we used to wear latex gloves, and they were great because they fit very nicely on the hands, and they were easy to use, and you can feel a vein if you're going to start an IV and so forth. But then people had allergies to latex. Latex, most gloves, by the way, come from Malaysia. They come from the sap of the trees, and so because they come from the sap of the trees, they have proteins in them. And those proteins are what people had allergies to. So they came up with the, they had vinyl and nitrile gloves. The vinyl gloves are kind of plasticky, so you're not going to have allergies to that, but they're kind of difficult to wear, to use. They don't form very well on the hands. The nitrile gloves, okay, are very good. They're elastic, they form well, and because they're a chemical component, there's no proteins in them, so there's no allergies, so people aren't allergic to these. The butyl nitrile gloves, okay, they look like those Playtex gloves that used for dishwashing.